Good morning. I'd like to call this roundtable to order. Today is Monday, June 3rd, 2024, and the time is 10:01 a.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will hear testimony from a number of nominees to boards and commissions under DC Health, including the Board of Medicine, the Board of Podiatry, the Board of Dentistry, and the Commission on Health Equity. Our first panel will consist of the Board of Medicine and the Board of Podiatry nominees. Our second panel will include Board of Dentistry and the Commission on Health Equity nominees. First, I will start with the Board of Medicine. The Board of Medicine regulates the practice of physicians, physician assistants, anesthesiologist assistants, surgical assistants, physicians in training, trauma technologists, and doulas and certified professional midwives. The board also currently oversees the practice of anesthesiologists and naturopathic physicians, although these professions will move under a new board of integrated healthcare within the next year, following the passage of Bill 25-545, the Health Occupation Revision General Amendment Act of 2023. PR 25-758 nominates Dr. Miriam Michael as a licensed physician member of the board for a term to end August 3rd, 2027. Dr. Michael is currently a physician at Howard University Hospital and the medical director for the American Renal Associated Dialysis Center. Dr. Michael received her Doctor of Medicine from Howard University, and she is a Ward 1 resident. PR 25-759 nominates Dr. William Strudwick for a reappointment as a licensed physician member of the board for a term to end August 3rd, 2026. This would be Dr. Strudwick's third and final term on the board. Dr. Strudwick is currently the chair of emergency medicine at Howard University Hospital and previously served as the medical director of the Emergency Care Center at Providence Hospital from 2004 to 2023. Dr. Strudwick received his Doctor of Medicine from Howard University, and he is a Ward 4 resident. PR 25-760 nominates Dr. Amra Madkour as a licensed physician member of the board for a term to end August 3rd, 2026. Dr. Madkour is an obstetrician and gynecologist at the George Washington Medical Faculty Associates, an assistant professor at the George Washington University School of Medicine and Health Sciences. He completed his medical degree at Texas Tech Health Center and is a Ward 5 resident. PR 25-761 nominates Dr. Harry Barbie as the consumer member of the board for a term to end August 3, 2025. Dr. Barbie is an assistant professor in the Department of Health, Behavior, and Society at Johns Hopkins University. Dr. Barbie holds a PhD in sociology from Florida State University and focuses their research on gender, sexuality, aging, and health, particularly with LGBTQ populations. They are a Ward 1 resident. The Board of Podiatry regulates the practice of podiatry in the district. The board consists of 2 podiatrists licensed in the district and 1 consumer member. PR 25-786 nominates Dr. Teresa Hilliard as a licensed podiatrist member of the Board of Podiatry for a term to end April 16th, 2027. Dr. Hilliard was confirmed to the board in 2006 and currently serves as the chair of the board. Dr. Hilliard is a practicing podiatrist with the Family Podiatry LLC, a medical practice located in Landover, Maryland. She is also the founder and CEO of Family Podiatry LLC. Her practice serves corporate entities, including senior communities and medical facilities such as the George Washington University Hospital, Howard University Hospital. Dr. Hilliard received her Doctor of Podiatric Medicine from New York College of Podiatric Medicine, and she is a Ward 4 resident. I don't see any of my colleagues here, but should any of them join us, we'll certainly refer to them for their testimony. Before we get started, I do need to swear in our witnesses. So in this first panel, we have Dr. Strudwick, Dr. Michael, Dr. Hold on, there we go. Dr. Madkour and Dr. Barbie, as well as Dr. Hilliard. 4 in person and then 1 is virtual. So Dr. Strudwick, are you with us online?
I am with you. Yeah.
Great. All right. Awesome. All right. So I need to swear everyone in. So if you could just raise your right hand for the ones who are in the room, and Dr. Strudwick online. Do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth. Great.
do.
Okay. Dr. Strudwick, when you're ready.
Sure. Good morning, Chairperson Henderson and members of the committee. My name is Dr. William Strudwick, and I am a practicing emergency physician and proud member of the District of Columbia Board of Medicine. Thank you to Mayor Bowser and Council for taking the time to consider my renomination. I appreciate this opportunity to testify today about my experiences and perspectives as a physician member of the board. I've been practicing medicine in the district for 36 years, and I have served on the Board of Medicine for 7 years. The Board of Medicine plays a critical role in ensuring the quality and safety of medical care within the district, and I'm honored to contribute to this mission in the district where I was born and raised. As a member of the board, our responsibilities include reviewing licensure applications to ensure that only qualified providers are permitted to practice medicine, investigating complaints against physicians to protect patients and uphold medical and ethical standards, participating in disciplinary hearings and making decisions based on evidence-based medicine and district laws and regulations, and contributing to policy and legislative discussions that shape the future of medical practice in our community. Moving forward, I envision several areas where we can further enhance our impact: technology integration, utilizing AI to better monitor and predict trends in medical practice; public awareness, increasing public awareness of the board's role in the complaint process to ensure patients feel empowered to report concerns; and interdisciplinary collaboration, fostering closer collaboration with other healthcare boards to address cross-disciplinary issues more effectively. In conclusion, serving on the DC Board of Medicine has been a profoundly rewarding experience. It has allowed me to contribute to the safety and quality of healthcare in my community while upholding the standards of our profession. I'm committed to continuing this work and exploring innovative solutions to the challenges we face. Thank you for your time and attention, and I'm happy to answer any questions you may have.
Thank you, Dr. Strudwick. Dr. Michael? Good. If you could just hit the button and there you go.
Good morning, Chairman Henderson and members of the committee. I'm Miriam Michael, and I'm humbled by your consideration for my nomination to serve on the Board of Medicine. I'm thankful to Mayor Muriel Bowser for nominating me, and I'm committed to using this opportunity to serve the residents of our district to the best of my ability. I have dedicated most of my career to serving the residents of Washington, D.C. Growing up here and raising a family who went through the city's schools has instilled in me a deep understanding of the community needs. And for the past 30 years, I've practiced medicine in over 11 area hospitals, gaining extensive experience across the various settings: HMOs, private practice, hospitalist groups, and academic institutions. This has provided me with a comprehensive view of the city's health care landscape, from a diverse patient population and insurance system to the strengths and limitation of different practice models. My qualifications for this position are deeply rooted in my comprehensive experience and unwavering commitment to patient safety and improved healthcare outcomes. Throughout my career in medicine over the 30 years, I have actively championed for more patient-centered approach to medicine, advocating for a better solution, better access to care, promoting evidence-based practice, and implementing innovative solutions to address local healthcare challenges. My passion lies in navigating the evolving healthcare landscape, where new models like telehealth and expanding practice scopes are changing the way that we deliver care. I firmly believe that effective regulation and oversight focused on patient well-being is crucial for successfully navigating these changes. You will see in my candidate questionnaire that I have co-authored over 40 articles, a sign that I try to share knowledge and help others learn from interesting cases I've seen in my practice. I'm board certified in both internal medicine and nephrology. You will also see from my candidate questionnaire that I'm deeply committed to health equity. I've spent a bulk of my career working at Howard University Hospital and at the Howard University College of Medicine. Many of the medical problems I have worked on fall especially hard on African Americans. If confirmed to be a member of the Board of Medicine, I will eagerly bring my expertise, knowledge, and unwavering dedication to public service. I am confident that my understanding of the local healthcare system, coupled with my commitment to patient safety and innovation, will be an invaluable asset to the board. I'm excited about the prospect of collaborating with my fellow members to ensure that the board's decisions continue to reflect the needs of our community and to lead for a healthier future for all residents in Washington, D.C. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I'll be happy to answer any questions.
Great, thank you. Dr. Madkour?
Good morning.
Morning.
Thank you, Chairman Henderson and members of the committee. My name is Ahmed Madkour, and it's my pleasure to receive your consideration for my nomination to serve on the Board of Medicine. I'm grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve the residents of our district. When I immigrated to the United States at the age of 17, it was to pursue an education in medicine. My passion from a young age, growing up listening to my parents, both doctors, at the dinner table recounting their days at the hospital. I received my medical degree at Texas Tech University and completed my residency in obstetrics and gynecology at Johns Hopkins Hospital in Baltimore. I have since practiced in the district, delivering babies and providing comprehensive women's care for almost 12 years. Recently, I've completed a master's degree in integrative medicine, providing me with further insight into perspectives and approaches to healing and healthcare beyond the biomedical model. Given that the oversight of the Board of Medicine includes practitioners of many types, I see this background as fitting for the task at hand. While my passion for medicine has led me to the kinds of humanitarian work that is glorified in our field, such as working in emergency obstetrics in Nigeria with Doctors Without Borders and volunteering with NGOs focused on maternal health development in Indonesia, I've also been privileged to serve our DC community in other important ways. I was fortunate to serve on the board of directors for Mama Toto Village, an organization leading the way in perinatal support services and education to offer creative solutions for our Black mothers and babies and their families. I have also been able to act in a regulatory and quality assurance capacity at my current institution, George Washington University and GW University Hospital, through committees such as the Peer Review Committee and the Perinatal Quality Improvement Committee. Each of these experiences has contributed to my own growth, and I have received just as much, if not more, than I gave. This continues to drive my desire to contribute to our community. If confirmed, I look forward to using my expertise and experience to improve the quality of medicine offered to our DC community. I look forward to the new relationships I will develop, new partners aligned towards the same goal of raising the standard of healthcare and the health of our citizens. Thank you very much.
Thank you. Dr. Barbie?
Good morning, Chairperson Henderson and members of the committee. My name is Dr. Harry Barbie, and it is my pleasure to receive your consideration for my nomination to serve as a consumer member of the Board of Medicine. I'm also grateful to Mayor Bowser for nominating me and honored to have this opportunity to serve the residents of the district. I would also like to thank the committee for this opportunity to share my testimony. And I'm proud to share my background with the committee today, as I believe it provides a strong illustration of my commitment to improving health and medical outcomes across diverse populations. I received my PhD in sociology from Florida State in 2020. During my time at Florida State, my scholarship focused on understanding how inequality persists within modern society. In particular, I studied how social locations like race, social class, gender, sexual orientation, and age influence people's life's outcomes. Moreover, as an openly queer, non-binary person, I was especially interested in understanding the experiences of lesbian, gay, bisexual, transgender, and queer populations. After receiving my PhD, I began developing a career that was focused on LGBTQ+ population health. In August 2020, I started working as a postdoctoral scholar at Vanderbilt University within the LGBTQ+ Policy Lab, an interdisciplinary community of scholars dedicated to understanding relationships between public policy and LGBTQ+ health. In 2022, I was named Vanderbilt University Postdoctoral Fellow of the Year out of several hundred postdoctoral scholars. I'm now an assistant professor at the Johns Hopkins University Bloomberg School of Public Health, the top school of public health in the United States. In that role, I conduct research that aims to identify, understand, and improve health outcomes among minority populations, particularly older LGBTQ+ adults. My work has been published in some of the top medical journals in the world, including numerous sections of the journals of the American Medical Association, such as JAMA Health Forum, JAMA Surgery, and JAMA Pediatrics. I also teach an annual graduate course titled Epidemiology of LGBTQ+ Health. The skills and knowledge base I have acquired throughout my professional experiences make me a strong candidate to serve as a consumer member on the Board of Medicine. As a health and aging researcher, I've spent extensive time investigating and writing about how research, medical practice, and public policy can serve as critical mechanisms to improve population health across life stages and reduce health disparities among historically marginalized communities. As an illustration, a large body of my work has examined how improving provider training in and transgender people's access to gender-affirming healthcare can improve transgender people's health outcomes. Along these lines, I have strong expertise in LGBTQ+ health that will add to the board's ability to serve our diverse community. Conservative estimates from Gallup suggest that about 10% of the district's population identifies as LGBTQ+. Compared to all states in the nation, Washington, D.C. has the largest proportion of LGBTQ+ people. As a queer non-binary person who is deeply involved in my community, I look forward to serving as a key liaison between the LGBTQ+ community and the Board of Medicine. If confirmed, I hope to support initiatives that utilize scientific consensus and a strong evidence base to ensure best medical practices and expand access to the highest quality care among populations who require it most. For instance, this could involve implementing my expertise in LGBTQ+ health to support patients and providers of gender-affirming healthcare. I could also utilize my expertise in aging research to support initiatives that address the needs of our oldest community members. And finally, a key aspect of my professional work has been communicating scientific research to the public and non-expert audiences. If confirmed to the board, I would like to implement my communication skills to ensure that the important work our board accomplishes is being successfully disseminated to the appropriate audiences, be it policymakers or the public. In sum, I believe my personal and professional experiences would make me a strong addition to the board. Thank you, Chairperson Henderson, for the opportunity to testify today, and I would be happy to respond to your questions.
Thank you. And Dr. Hilliard. Oh, you turn your mic on. There you go.
Good morning, Chairperson Henderson and members of the committee. I am Dr. Hilliard. I am couldn't be more thrilled to stand before you today seeking your consideration for my nomination to continue to serve on the Board of Podiatry. I am profoundly grateful to Mayor Marion Bauer for nominating me and absolutely honored by the chance to continue to serve the wonderful residents of our district. It fills me with immense pride to be selected to continue to serve on the Board of Podiatry. As a passionate podiatrist in the metropolitan area, I have dedicated myself to serving the residents of the District of Columbia and beyond. In addition to my professional career, I bring with me the invaluable experience of over 28 years as a retired military officer and veteran, as well as a heartfelt commitment to the District of Columbia foster parents. My tenure on the board has been a deeply rewarding journey, and I am eager to continue serving in this capacity with renewed vigor. As a proud resident of the District of Columbia, I am actively involved with both the Maryland, Virginia, and the District of Columbia Podiatry Associations. I make it a point to stay connected with the local podiatrists, ensuring I understand their needs and aspirations. Moreover, I engage with my neighbors in Ward 4 and other wards, enthusiastically participating in community health fairs and gaining insight into the healthcare needs of our community. 5 years ago, I faced a significant challenge when a patient felt that I was responsible for his unfortunate loss of his foot. The case was eventually dismissed and settled out of court, but this experience profoundly impacted me. It deepened my empathy and understanding of the community's anguish and the critical role of healthcare. Today, the need for podiatric care in our community is more critical than ever. With 1 in 5 people affected by diabetes or having a family member who is, preventive care and maintenance are essential. Podiatry is a vital piece of the puzzle in maintaining a high quality of life. I'm passionately committed to advocating for the proper podiatric care and maintenance of our residents of the District of Columbia. Recently, I championed the cause for podiatrists to treat both fingernails and toenails for residents who are medically qualified. I also advocate for expanding the scope of podiatric practice to enhance community care. Because I live in the district, I am eager to continue supporting the district activities promoting care and ensuring the best podiatric care for our community. Thank you.
Thank you. Thank you to all of the witnesses for your testimony, and thank you so much for your willingness to serve. I feel like ever since I've been chair, I've been putting out these massive PSAs of come one, come all, come serve on our boards and commissions. It is a lot of time and it's a lot of effort, I know, from all of your professional duties as well. So it certainly does not go unnoticed. I'm going to start with some questions for some of the newbies, and then I'll get to some of you who have been on the boards and are being renominated. Dr. Medcore, did I hear correctly that you said you went back to school to get another master's in integrative health because you just didn't have enough degrees already?
That's correct. So during the pandemic, I started a master's degree at GW.
Okay.
And it's integrative medicine. And there's actually a board of integrative medicine. And so I'm seeking membership to that board as well. And I'm also looking to be involved in our GW Center for Integrative Medicine.
Mm-hmm.
So I believe that our biomedical model is insufficient in addressing the whole person. It's reductive, and that's part of the philosophy of integrative medicine is to draw from other sources, not just other treatment sources, like whether it's other treatment modalities, other healing traditions, using nature as a healing tool, but also trying to understand people in the context of their environment and like how much their environment plays a role in health. And that's something that I think medicine in general has been increasingly interested in, and we're a little slow to the uptake, but thinking about social determinants of health, for example, I think increasingly we are factoring those things into our healthcare model, but that's one of the things that I've really enjoyed in the past few years. Yeah.
Awesome. Do you feel like other physicians are open to more, I don't call it alternative methods, but obviously integrative medicine is a little bit different than how some physicians are traditionally trained in terms of solutions to certain clients' issues?
Yeah, I would say it's a little challenging to generalize, but I do see different trends in medicine. I think on one hand, we're increasingly siloed in medicine as there is a constant sort of pressure and influence to subspecialize, and that kind of results in people being entrenched in like sort of these narrow fields, and it can be harder to see the forest for the trees sort of thing.
Yeah.
But I also think that a lot of the interest in like integrative medicine or alternate forms of medicine is consumer driven. So much of it comes from people recognizing that there are limitations to what they get in sort of like a standard biomedical model, and they're interested in looking at alternatives, whether it's non-pharmaceutical approaches to treatment, looking at like using things like botanicals, mind-body medicine, looking at Chinese traditional medicine, acupuncture, things like that. So, because there's such a strong interest on the side of the consumer, and increasingly with social media, people are getting much more exposure to these, these other options. There's always going to be a need, I think, and then a need for physicians to be more familiar with these options.
Yeah. I've learned a lot about the various professions under integrative medicine when we did the Health Occupation Revision Act, and sort of learned about acupuncture and all of these various pieces and their particular scopes of practice. And so I think it's really cool that you were like, I want to learn more. So let me go back and get some more work on that. But, I guess you're traditionally trained as an OBGYN. And I noticed that you've published a couple of articles related to maternal health. Can you elaborate a little on your research interests there and just sort of overall are there some areas that you want to bring to the work of the Board of Medicine as it pertains to maternal health? I think we have one OBGYN who is currently serving on the board.
Sure.
She would love to have a colleague.
Um, I absolutely love what I do. I have a very distinct privilege and honor of like being able to provide like health care to women in some of their most vulnerable times. And much of my research is centered on being able to provide options and not have women feel like they are sort of compelled to pursue only like one option when it comes to like their pregnancies and decisions in pregnancy. So some of my research currently is about fetal malpresentation, basically how to manage like breech presentations, which comprise about 4% of all term pregnancies. So over like a large population, that's a significant number of pregnancies, and over 95% of those are delivered by C-section. And so an area of my focus and expertise is trying to improve options for those women, whether it's through external cephalic version, which is a procedure to change the position of a baby. And I actually have a case series of doing this in twins, which I'm hoping to publish soon, which is kind of a unique setting. We also have at GW something that I'm particularly proud of, which is a vaginal breech program, one of the few in the country actually, and so it's a very valuable asset to our community, where we provide support for trials of breech vaginal delivery, and something that as a department we're very, very proud of, because it's saved many women, over 80 now, I believe, between 70 and 80 maybe, from having to have a C-section, whereas pretty much anywhere else they would have ended up with one. So that's one of the areas I'm particularly proud of.
Awesome. Thank you. Dr. Barbie, I got confused for a minute because he was like doctor, and then I was like, oh, no. He's a sociologist. Sorry. They are a sociologist, not a physician. But you've done a lot of research on LGBTQ health disparities and aging. I'm particularly interested on the aging portion of that. How would you plan to leverage your research on informing the policies and decisions of the board?
So aging communities obviously have unique health requirements. I specifically focus with LGBTQ plus people. So older LGBTQ plus populations have lived through vast
Don't worry.
cultural changes, political changes, and that has certainly had an influence on their health. Changes in access to healthcare, changes in access to various institutions, including marriage, changes in policy such as anti-discrimination policy. These all influence their health and how they approach their health, including their health behaviors. And so I think these are important things to consider when thinking about, for instance, what kinds of training medical providers need to have, what kinds of understandings, cultural competencies they should have with regard to diverse populations. And so these are expertise that I have and I think would be very useful on the board.
How comfortable are you speaking up in a crowd when everyone else at the table are physicians? As a consumer member, I feel like sometimes it can be a bit intimidating to share your perspective, however valuable it may be, when you're having other folks who are in the room who are talking in specific terminologies around the practice of whether or not they're dealing with a disciplinary case or otherwise.
Absolutely. I think it's in a way sort of a matter of just knowing my lane, if you will. But I'm also, to be clear, I'm very confident in my expertise. I'm confident in the skills and knowledge base that I have developed. And I think those offer important contributions that perhaps MDs may not have. And so I think it's a matter of creating an interdisciplinary space where we can all bring our skills and knowledge base to ensure that evidence-based practices are being implemented and creating the most expansive access possible.
Great. Look, all of our boards have a consumer member, and I asked this question of them as well, because we found it important enough to include that voice and perspective. But if folks go into the room and then don't say anything, then that perspective and voice is lost. So
Mhm.
I'm glad to hear you say that. You did mention that you are a professor at the Bloomberg School,
Correct.
who I love their social media, by the way. I feel like it's probably
Yes.
one of the most informative public health communication
Mhm.
tools there. Do you commute back and forth?
So I teach it, yeah, I'll take the MARC train when I have to meet with students, and I teach an 8-week course. So
Okay.
I commute when I teach. Mhm.
Okay. All right. Dr. Michael. Let's see, I think you've done some research around preventing hospitalizations and mortality in the district. How will you apply this research to your role, the Board of Medicine?
So one of my, it's hard. I love everything, so it's hard to be specific. But one of my very, very deep interests is high value medicine and
Is what now?
high value medicine and
High
being
value
a being able to give medicine that is evidence-based, that reduces cost to the society, and also has the best outcomes for patients. And I think that's a really fine line. And it allows access for more patients if we actually have the not only just the patient, but also the system in mind when we're giving care. So that's been really a lot of my focus. I find that a lot of it has to do with being able to make a diagnosis. One of the things that I teach is I teach physical diagnosis and to medical students. So I think that being able to make a good differential, implementing that quickly, doing high value care makes everybody, including the system, a winner. And that's been my goal, is that we continue to do that so that our system survives and is able to benefit everybody.
Right. Are there specific things that you're hoping to accomplish during your term on the Board of Medicine?
So I do have a deep interest in a lot of populations that are marginalized. My patients tend to be older. They tend to be very sick. I'm a nephrologist, so that by nature means that they have complicated diseases. They access healthcare a lot. And my goal has always been that I provide really strong primary care. My start was at Kaiser, which really did define how I do medicine. You try to take care of the patient holistically, and then that seems to improve. So my goal is that district population has good access to primary care. I guess you can tell I'm very involved in vaccine research. And I believe that vaccines and preventive medicine is probably the hallmark to population health. So I'm hoping that that comes through on my work here.
I think we're going to need that perspective and that value. It's funny. I was watching the news this weekend, and my nephew was they were talking about bird flu or avian influenza.
That's coming.
And he was like, "Oh my gosh, this is so crazy, XYZ." And I was like, funny enough, like back in 2006, when I was an intern at HHS, bird flu was a thing then. And so it was, but people's views or trust in institutions have varied greatly. So in 2006, people were listening to us around what you should be doing, washing your hands otherwise, but also, dealing with live stock, et cetera.
Pigeons.
Correct. And I feel like now it's like, if we were to have if avian influenza was to become a true contagious outbreak thing, I don't know how it's going to go this time around.
And especially now with the world getting hotter, that means that all these bugs now have a new mandate. They are like supercharged. I think we're just going to see a lot more pandemics coming around our way. And I think having a system in place where we build trust and we're able to get vaccines and get people to actually take them is going to be a big deal.
Yeah. All right. I think we're going to definitely, I know from the DC Health perspective, we're going to be turning to the Board of Medicine in terms of having these trusted conversations. Is even when we do routine child vaccines and having conversations with parents who are like, well, I don't know what's in the polio vaccine. And I was like, neither do I. But you know what? We've been taking it. You took it. Your mama took it. Like, and now we're having measles outbreaks. And it's like, get your children vaccinated. Could have been prevented. Okay. I hate to go down that sort of dark road. Let's knock on woods that it's all going to be contained and it's all going to be fine. Dr. Strudwick, the time on the Board of Medicine, at least from what I understand, these meetings can be involved. Why do another term?
I enjoy it. I think I learn a lot from it, and I think they learn a lot from me. It is a big commitment, so it takes several hours to prepare for the meeting because you have to review all the cases, you have to review all the applications, and the meeting generally starts at 8:30 and it ends at 3:30 to 4. So, and it comes every month. It's always coming. So it is a big commitment, but I'm a DC native. I love my city. I love the population that I'm blessed to be able to serve. And I think being on the board, it allows me to play a great role in protecting the health of the citizens, as well as protecting the providers. It's not one way with medical issues. So it's just been very fulfilling. And I look forward to, actually, I was surprised that this is it for me. I wasn't aware that you could only do 3 terms.
Yeah.
Yeah, I look forward to it. And I'm impressed by my new colleagues that I'll be able to work with, the accomplishments, and look forward to working with them.
Yeah. Thank you. So you mentioned in your testimony 3 areas of focus: AI, technology, innovation, public awareness, and interdisciplinary collaboration. I think we've talked about the public awareness. I talked about that a little bit with Dr. Michael, the interdisciplinary collaboration with Dr. Madcore and Dr. Barbie. Let's talk a little bit about the technology, innovation, AI piece of it. I think in general, there is some skepticism around AI and technology. I think in medicine, however, it can be very incredibly valuable tool. Do you feel from your research and work thus far, are there some pitfalls that we should be aware of going in and sort of using AI in the technology, or excuse me, in the health space?
Right. I mean, the statement that I like to tell people is that you're not going to lose your job to AI, but you will lose your job to someone who's using AI. So I think, we have to use it as a tool. Like one of the tools that, one of the many tools that we use. It's not to replace, our expertise, our personal touch, and our personal knowledge. But you can, what I see is that you can use it to improve efficiency in a lot of areas, specifically putting data points in order to give us some insight as to what applications and what what is the typical profile of a provider that provides fantastic care to our citizens? When do we have to spend more time scrutinizing applications and complaints, and when can we spend less time, just based on data and based on trends? So I think using AI appropriately to improve efficiency, and we talked about the length of the meetings that we have. If we are able to cut down some of the time based on data points and information that is trended through AI, I think that could make our meetings more efficient, more focused on the issues that we really have big value in terms of protecting our citizens and protecting our providers as well.
Yeah, I think what you're saying in terms of building efficiencies, it isn't just a tool that could be used for board members, but also for folks who are seeking licensure or to get renewed. That's oftentimes the complaints that we get about the boards, not just the Board of Medicine, but all of the boards, is like, why is it taking 6 months for them to review?
Right.
What's going on? Virginia already approved my application. Maryland already approved my application. So we're always looking for opportunities of, not to say speed it up to the point where it's just pro forma, because we certainly want you to review and investigate where there are questions, but there are always ways for us excuse me, I think there are always ways for us to get better on that front. But thank you so much again for your willingness to serve. Dr. Hilliard, learned a lot about the Board of Podiatry through the HORA situation. And I want to thank you and your colleagues for engaging in that conversation. You would be surprised to know that I did have some physicians in other areas who the night before the vote were like emailing us saying, we had no idea that this was happening. And I was like, it's been 8 months. I don't know what to tell you. I was like, I've had lots of people who testified about this, with some of the scope of practice changes that were being brought up. Similar to Dr. Strudwick, why serve another term?
Similarly, I'm enthusiastic here as a member, as a resident of the District of Columbia, first of all, and I want to participate in what's going on around me. And I appreciate with vigor the changes, everything from telemedicine, AI, to having the services available to our public. And I'm a part of that.
Great. You talked a little bit about wanting to engage the community more in terms of access to podiatric services, et cetera. Can you say more about that?
Absolutely. Well, as you saw me testify on the HORA in reference to expanding the practice of podiatry in terms of including fingernails. The question is, who will do that? And who's capable? Who's able to do that?
Who does that now?
Henceforth is the reason why I have proposed that as part of the podiatry scope. We used to be chiropodists. We used to be chiropody, which included hands and feet.
Interesting.
Mhm. So, I mean, that's a whole nother topic and another
Yeah.
push.
Yeah, now I'm gonna have to go and like look that up because now you piqued my interest there. Okay, well, I'm glad that you are gonna do another term. I think that there is still, our records indicate that there is currently one vacant seat that's on the board.
Yeah.
So my PSA for any of your colleagues out there who would like to serve, contact the Mayor's Office of Talent and Appointments, fill out the form. My last question for all the nominees who I didn't ask yet, not for the folks who are being renominated, they understand what the time commitments are, but for you newbies, has MODA and DC Health talked to you about the time commitment for serving on this board? And do you feel like you are able to dedicate sufficient time to not just preparing for the meetings, but also for the meetings themselves?
Yes.
Great.
Yes.
Great.
Yes.
Yes.
Awesome. I'd just like to hear it on the record. Okay. Is there anything I haven't asked any of you that you want to say for the record? Awesome. All right. Well, thank you so much for your testimony. Thank you for being willing to serve on a district board. Again, you're not only serving district residents, but you're serving your colleagues. And so I wish you the best of luck in that work and on your tenure. But thank you so much. We're going to go to the
Thank you.
next panel, which are nominees for the Board of Dentistry and the Commission on Health Equity. All right. The Board of Dentistry regulates the practice of dentistry and dental hygiene in the district. The board consists of 5 dentists licensed in the district and 1 dental hygienist, as well as 1 consumer member appointed by the mayor. PR 25-791 nominates Dr. Chanel Roberts as a voting member of the Board of Dentistry as a dentist licensed in the District of Columbia with a term to end November 30th, 2025. Dr. Roberts is a general dentist at Capital Dental and has previously worked at the Maryland Center for Aesthetic Dentistry. Dr. Roberts earned her Doctor of Dental Surgery from the University of Missouri, Kansas City. PR 25-792 nominates Dr. Amani Lewis as a voting member of the Board of Dentistry as a periodontist licensed in the District of Columbia. Sorry, Dr. Lewis, with a term to end November 30th, 2025. Dr. Lewis owns and operates Lewis Periodontics and Associates, PLLC, a practice in the district. Dr. Lewis earned his Doctor of Dental Surgery at the University of Michigan and is a Ward 4 resident. The Commission on Health Equity is located within DC Health's Office of Health Equity and is tasked with developing recommendations to address health inequities in the district. The commission has 9 voting members, including six members appointed by the mayor with council approval and 3 members appointed by the council. Each voting member must have expertise in at least one of the following areas: health equity and social determinants, and health disparities. B, social and human services and vulnerable populations. C, early learning and education. D, minority communities and community health outcomes and improvement. E, economic and community development, or F, ecological and the natural and built environment. PR 25-740 nominates Nicole Strachan as a voting member with expertise in ecology and the natural built environment for the Commission on Health Equity for a term ending February 1st, 2026. She currently serves as a speech pathologist at MedStar Georgetown University Hospital and Howard University Hospital. She was was also an ethical leadership and racial justice fellow at Howard University School of Divinity. Ms. Strachan has worked as a speech language pathologist for over a decade, including within DC Public Schools. She has a Master's of Science in Speech Pathology from the New York Medical College, Master of Science in Bioethics from Columbia Universities, and a Master of Divinity from Howard University. It's another one with like 4 and 5 degrees. She's a resident of Ward 3. PR 25-742 nominates Dr. Sienna Barker as a voting member with expertise in early learning and education to the Commission on Health Equity for a term to end February 1st, 2025. Dr. Lynn Hales Barker is currently the Chief of Programs and Community Services at La Clinica de Pueblo, a federally qualified health center in the district where she oversees community-facing programs that addresses social and structural determinants of health. Dr. Lynn Hales Barker previously conducted research for the State University of Rio de Janeiro Center for Adolescent Health Studies. Dr. Lynn Hales Barker earned her Doctor of Science in Public Health from the National School of Public Health in Brazil. She is a Ward 4 resident. PR 25-743 nominates Anna Lopez Von Balen as a voting member with expertise in economic and community development of the Commission on Health Equity for a term ending February 1st, 2025. Ms. Van Balen is currently the Vice President of Economic Security and Justice at Futures Without Violence. Previously, she serves as the first affordable housing preservation officer at the Department of Housing and Community Development, helping to preserve the diminishing stock of affordable housing in the district. She then became the first director of housing policy and programs for the Office of the Deputy Mayor for Planning and Economic Development, where she oversaw housing-related initiatives across the government. Ms. Van Balen earned her Master of Science in Social Work from Columbia University and is a Ward 1 resident. All right. Before we all get started, I need to swear you all in. So if everyone can raise their right hand on the screen so we can see you. Do you swear or affirm under the penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Great. All right. We will start with Dr. Roberts.
Good morning. Good morning, Chairperson Henderson and members of the Committee on Health. My name is Chanel Roberts, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Dentistry. I'm so grateful to Mayor Browser for nominating me and honored to have this opportunity to serve the residents of our district. When I saw the email calling for applications to the Board of Dentistry this past fall, I admit that I initially kept scrolling. What would I have to offer at this stage of my career? I couldn't possibly be an asset to this group of professionals tasked with regulating the practice of dentistry, something I hold so close to my heart. But I had to pause for a moment and truly consider what was being presented to me. The district was searching for passionate professionals, and anyone who knows me can attest to my passion for dentistry, with a minimum of 3 years experience, which I also have. Those serving on the board will have a common goal of protecting our residents by ensuring that the dental professionals here are held to the highest standard. This directly aligns with my own professional and academic experiences. After graduating from Hampton University, an institution whose core value is maintaining a standard of excellence, I strove to embody that in my continued endeavors. I first worked for my local public school system as an educator in an alternative high school, an experience that really opened my eyes to the disparities, health and otherwise, that our communities face. I maintain leadership and social positions in all of my academic programs, helping develop curriculum for the same leadership programs I participated in as a student. I've spearheaded interdisciplinary mentorship programs to encourage collaboration and understanding across health professions. Joining a historic dental practice, Capital Dental, has offered me more mentorship and support than I could have ever imagined. From day to day, I'm able to interact with patients from all walks of life, all across the district, to understand the needs of our DC community. If I'm able to hold my colleagues to these standards of excellence, I can certainly do the same for my colleagues. When it comes down to it, I want to be part of the Board of Dentistry because I care about the oral health of our community. I knew from the age of 10 that I wanted to be a dentist and that I wanted everyone to have pearly white smiles. When I'm practicing, it's paramount that I impart healthy habits to my patients so they can take that knowledge home with them. I tell patients every day that before I was a dentist, I was an educator, and I want them to have the tools to make healthy decisions. But outside of those decisions, the patients must make on their own. I want to ensure that their providers are affording the patients appropriate treatment and access to the best healthcare resources. It seems like every week our office is welcoming new patients who recently came from other practices where they felt like they were being overtreated, which sometimes I agreed with, or they didn't actually understand what was happening in the first place. I want to be part of this board to have a hand in ensuring our community has access to quality health outcomes. If confirmed, I will work tirelessly towards the best interests of the public we serve. I will hold my colleagues to the standards we believe are appropriate and prioritize the well-being of our patients. I believe the board should be composed of individuals who are not necessarily like-minded, but whose goals align. Members who can draw from their different perspectives and experiences to come together in agreement. I hope we are able to improve relationships with other health professionals, for instance, working with pediatricians to improve the resources available to them when they encounter signs of compromised oral health. I admire the board's history of ensuring clinical competency for dental professionals, upholding the parameters of care. The recent regulations expanding the scope of practice for dental assistants in the district is just one example of how the Board of Dentistry is able to use their reach to provide more care to our patients. I hope to be able to continue this good work for the betterment of our DC community. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to any questions you all may have.
Thank you, Dr. Roberts. Dr. Lewis?
Good morning, Chairperson Henderson and members of the committee. My name is Dr. Imani Edward Lewis, and it is my pleasure to receive your consideration for nomination to serve on the DC Board of Dentistry. I am sincerely grateful to Mayor Bowser for nominating me and honored to have this opportunity to serve the residents of the District of Columbia. Dentistry has been a major focus throughout my life. I earned my BS at Morehouse College, graduated magna cum laude, and went on to complete my dental training at the University of Michigan School of Dentistry. I earned my master's in periodontology at the University of North Carolina at Chapel Hill, and then a diplomate of the American Board of Periodontology. I made Washington, D.C. my home upon completion of my periodontics residency. I have lived in several D.C. communities and have come to love the city, its culture, and diversity. I currently reside in Northwest D.C. with my wife and 3 school-age children. I established my periodontics practice within the district and have built it over the past 13 years. My office is located downtown and serves a wide cross-section of the DC community. Over the years, my practice has grown due to my focus on developing strong professional relationships, providing exceptional patient care, and helping to address the needs of the community. My commitment to the community extends beyond healthcare. I have actively participated with the Banneker City Little League since 2020, serving as an assistant coach for several seasons. The DC Board of Dentistry is tasked with the obligation of regulating the practice of dentistry and dental hygiene within the district. The board sets policies that will impact dental education, the needs of the community, and the standards of clinical practice. I believe a strong and well-functioning governance board serves the interests of all concerned, all constituencies. I am deeply aligned with the aim of the board and assisting in maintaining the high standards governing my profession. I applied to serve on the Board of Dentistry because I want to serve the dental community and help to shape the future of clinical practice. As a board-certified specialist with over 14 years of private practice experience, I can offer unique perspective and the expertise to ably serve the community and the members of the dental profession. I have worked with many healthcare professionals in DC and our surrounding jurisdictions, and was voted by my peers as a Washingtonian top dentist in 4 consecutive cycles. My background will allow me to serve as a bridge to the patient community, bringing forward policies, updated policies and practices for their benefit and protection, as well as a bridge to the dental community, effectively communicating the concerns of both general dentists and dental specialists. If confirmed, I possess the skills and knowledge to help guide the next generation of leadership in the dental profession, and I am committed to addressing the dental health disparities in the District of Columbia. I will work to see continuous improvement in licensing processing so that it is efficiently done and in keeping with best practices. I would like to assist in shaping board policies as we see further expansion of dentistry into head and neck medicine, and an increased role in technological advances affecting the dental profession. Lastly, I will focus on initiatives that increase access to care and addressing the needs of the underserved. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee.
Thank you, Dr. Lewis. We're now going to go to our Commission on Health Equity nominees. Ms. Strachan.
Good morning, Chairperson Henderson and members of the committee. I am Nicole E. Strachan, and it is my pleasure to receive your consideration for my nomination to serve on the Commission on Health Equity. I'm grateful to Mayor Muriel E. Bowser for nominating me and honored to have this opportunity to serve the residents of our district. Almost 14 years ago, in the summer of 2010, I had just graduated with my first master's degree in speech pathology. And after receiving research and leadership training through a Maternal and Child Health Bureau funded fellowship in leadership education and neurodevelopmental disabilities, I applied and was selected to participate in a disability policy internship opportunity here in Washington, D.C. at the National Association of Social Insurance. I packed up my car and drove to Washington, D.C. for a summer that would transform my life. I was immersed in the world of social insurance, safety net programs, economic security, health policy, and disability employment, and discovered a new passion. Key mentors supported and encouraged me to pursue a career in the work of research policy and advocacy. I have since learned that pursuing clinical work and policy did not have to be an either-or situation. In fact, having the experience of both clinical and policy advocacy work is a powerful combination to make a difference. Every nursing home, hospital, outpatient clinic, and home health agency where I've had the privilege to help improve the quality of life for patients and families since that internship has given me invaluable raw data to interpret research and brings to life the real stories behind the statistics and health disparities. I have a multitude of evidence to support the truth that all policies are truly health policy. Housing policy, educational, and economic policy all have significant impact on health equity. I returned to DC during the pandemic to complete theological study at Howard University following a prior degree in bioethics because spiritual well-being and autonomy are also social determinants of health, particularly for those who look like me. The chance to serve on this commission represents a full circle moment. It affirms the call I had to return to DC and the eagerness with which I applied to this committee. I have lived in Ward 8 and Ward 3. I have been on the front lines of healthcare, working at the genesis of life's trajectories in the neonatal intensive care units at Howard University and Georgetown University hospitals, and formerly in early learning and education at DC public schools. I have had the privilege to lead program development, organize community-focused initiatives, and plan health services to help providers dealing with burnout and the moral distress of caregiving so that they can show up their best selves for themselves and for those entrusted in their care. I have written and delivered sermons and teaching to the community that incorporate themes of health equity to present knowledge in inspiring and informative ways that are sacred and relevant within the Black community and Black church tradition at large, building on the historical legacy of social justice of the African Methodist Episcopal Church. I am passionate about merging my scholarship, clergy, and clinical capacities to serve all who battle the effects of social and structural determinants of health every day. The opportunity to join this commission means taking intentional and collective action to move the conversation beyond fallacies and finger pointing toward truth and meaningful partnerships that will address access to quality healthcare and combat structural and institutional racism. I intend to apply my perspectives as a clinician to providing resources and relationships that support equitable trajectories at the very start of life for our youngest residents who are often born into challenging situations. I believe that garnering community support and organizing through avenues such as the Black church and historically Black colleges and universities could have a collective and individual impact of divine magnitude. These institutions historically drove not only spiritual, but political and social change that improved the lives and amplified voices of the marginalized. In closing, I'm excited about this opportunity to support this commission, and thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee.
Thank you. Dr. Lynn Helsbacher.
Good morning, Chairperson Henderson and members of the committee. I'm Suyana Linhares Barker, and I'm pleased to receive your consideration for my nomination to serve on the Commission of Health Equity. I'm grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve the residents of our district. With over 30 years of professional experience, I have dedicated my career to applied equity-informed practice and implementing community-level public health interventions, specifically addressing the needs of low-income, underserved Latin Americans. I joined La Clínica del Pueblo, a federally qualified health center in Washington, D.C. in April 2010 as a Senior Director of Health Equity and Community Action. My unique contributions were recognized when I received a Distinguished Community Advocate Award from the District of Columbia Primary Care Association in October 2015. More recently, during my tenure at La Clínica as a Chief of Programs, I provide strategic direction for developing and evaluating community-based programs. I have also led the development of the Health Equity Department and spread ahead the growth of community-level strategies, intersectorial partnerships, and advocacy efforts to address our clientele's core social and structural determinants of health. A native of Brazil, I hold a doctorate degree in public health from the National School of Public Health in Brazil, a master's degree in social psychology from the State University of Rio de Janeiro, and a Bachelor of Arts degree in psychology. My work experience includes 10 years of research for the primary healthcare program at the State University of Rio de Janeiro Center for Adolescent Health Studies, and 9 years of consulting for various national and international organizations, including the Pan American Health Organization, the International Labor Organization, and the Brazilian Ministry of Health. Moreover, my journey as an immigrant has given me a unique perspective and deep understanding of the challenges faced by marginalized communities. I have experienced firsthand the feeling of not belonging, the struggles to identify the right resources, and the barriers to understanding discrimination and isolation. This personal experience has fueled my passion for health equity and my commitment to addressing social determinants of health. From the start at La Clínica and my work in Washington, D.C., I have focused on infusing the equity lens throughout our work to include the strategies to address equity in all of our work. I genuinely believe that the Mayor's Commission on Health Equity is essential for Washington, D.C., as it plays a critical role in identifying and addressing health disparities, ensuring inclusive policy development, and engaging marginalized communities. It's a privilege to support data-driven decisions, foster collaboration among stakeholders, raise public awareness, and monitor the progress of health equity initiatives. The Commission's efforts have the potential to promote social justice by guaranteeing that all residents, regardless of their background, have equitable access to healthcare and opportunities for optimal health, thereby fostering a healthier and more equitable community. If confirmed, I plan to leverage my work, academic and my personal experience to significantly impact health disparity by advocating for inclusive policies that integrate health considerations, engaging with marginalized communities to incorporate their voice, supporting relevant research, fostering partnerships with health providers, raising public awareness, advising on health programs development that address social determinants of health, and monitoring the progress of health equity initiatives. My goal is to help to ensure that all residents, including immigrants, have equitable access to healthcare and opportunities for optimal health. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to answer questions from you and any council member. Thank you.
Thank you. Ms. Lopez Van Bellen?
Yes, good morning, Councilmember Henderson and members of the committee. I am Ana Lopez Van Balen, and it's my pleasure to receive your consideration for my nomination to serve on the Commission on Health Equity. I am grateful to Mayor Bowser for nominating me and honored to have this opportunity to serve the residents of our district. I have spent my career addressing the inequities and disparities for immigrant and other vulnerable populations by addressing the structural and social determinants of health in our communities. As a trained social worker, as a former district employee focused on supporting the mayor's affordable housing goals, and now in my work to prevent and support survivors who have experienced gender-based violence, I believe I have much to offer the committee in formulating its annual health equity recommendations to the mayor. I have direct experience with 4 of the 6 required areas of expertise for a voting member, and specifically my work points to the following outcomes: addressing disparities and inequities that impact the health and well-being of communities, developing social safety net programs for vulnerable populations, improving health outcomes for minority communities, specifically for women, Latino, and immigrant communities, and developing economic and community development opportunities through workforce development, affordable housing, and homeownership. I currently work at Futures Without Violence, a national organization that partners with communities to upend the conditions that fuel violence and shape systems so survivors of violence have the support they need to heal and thrive. As Vice President of Economic Security and Justice, I focus on strengthening women's economic autonomy and decision-making power, advancing more equitable laws and policies, and creating more accessible pathways to employment and safe workplaces that allow women and all workers to thrive. One of the tools I oversee is the National Workplace Resource Center on Sexual and Domestic Violence, which supports survivors, employers, unions, and advocates to prevent and address gender-based violence and harassment in the workplace. As a result, I believe that my experience, commitment to equity, and as a Latina living in Ward 1, there is much I can contribute to the development of the city's health equity goals. I look forward to working with the Commission to support its work in assessing health equity across the city, strengthening its reach, and furthering its impact in our great city. Thank you, Councilmember Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee.
Thank you. And again, thank you to all of you for your testimony, for being here, but also for your willingness to serve. I'm going to start with our Board of Dentistry nominees. Dr. Roberts, how would you characterize access to cosmetic dentistry in the district?
It's interesting that you said access to cosmetic dentistry, because I believe right now we have a lot going on social media when it pertains to cosmetic dentistry. There's a lot of Instagram providers. I don't want to say dentists because they did not go to school. I have people coming to me every day, friends and strangers alike, who want to hear me kind of weigh in on dentistry as it is right now when we talk about the people who are able to access the materials that we use. They're pretty widely available. And sometimes you have someone who just figured it out or Googled it somewhere or used to work in a dental office. And so they believe that they know what they're doing, and they're trying to provide services to patients, many of whom are unsuspecting, and, you know, they don't realize that they're putting their health into the hands of people who have not trained for this. So I do believe that right now, there are plenty of people who are providing services who are not being monitored and don't know the reasons behind why we do what we do. And I believe I've been working very hard to make sure everyone in my circle in the immediate vicinity knows, it doesn't have to be me. But if you're going to reach out for services, dental services, just like you wouldn't go to someone on the street to set a bone, I say don't go to someone on the street to do your dental work. So I
Yeah. And to be clear, many of these individuals on TikTok and otherwise are engaging in unlicensed practice.
Absolutely.
And should be reported.
They absolutely should. And so I do always encourage the reporting of these unlicensed dentists, but I do believe the board should continue to have a hand in trying to make sure that we're protecting our public from these unlicensed dentists, but then also protecting them from dentists who may not be working in the best interest of their patients as well.
I'll open this up to Dr. Lewis as well. What do you feel like is the role of the board in sort of raising public awareness around, and I could ask this probably for any of the health professions, right? Raising awareness around licensed practice versus unlicensed practice, and what should consumers do if they have questions or are uncomfortable in those situations?
I definitely think the board can have a hand in making sure we're putting the right nomenclature out to people when, people are saying they're getting their dental certificates and stuff like that. I did a training course, making sure the public understands what the actual credentials they need to look at when they're booking a doctor or any type of procedure and everything like that. It's commonplace to have your licenses and everything like that posted on the wall in a dental practice. Make sure you see that. Make sure you know that these these providers went to an accredited dental school, and are up to date on all their licenses and everything like that. But I think, as well as just kind of making sure, I'm sorry, I kind of got a little turned away.
No, it's okay. Dr. Lewis, in terms of public awareness, how should the board be raising public awareness around the appropriateness of certain licensures for doing certain work? And what should consumers do if they have questions or if something doesn't feel right?
I think the board, the design of the board is to set the standard, for practice. And so I think we want to be the voice of the community, but also we want to have, I don't know if it can be done with open forums and so forth, but have the opportunity to hear and communicate with the public.
Great. It's great that you both are practicing dentists. I've heard from dentists in prior years. One of their complaints about the Board of Dentistry was that it was a lot of, or it skewed more towards retired dentists who weren't necessarily currently practicing and therefore dealing with, the things that you all are seeing in your practices today. I wanted to ask, Dr. Lewis, so you currently serve as a diplomat for the American Board of Periodontology for the public. Those who hold that particular status have made significant achievements beyond mandatory educational requirements of a specialized field in dentistry. How will your advanced training enhance your ability to serve on the board and make informed decisions?
So I think that, excuse me, training always, helps. So if you have the training in your profession, but also as a specialist, you have the ability to communicate with general dentists as well. And so I think a major factor is serving as being, as I mentioned, the bridge between communicating the concerns of specialists, but also the concerns of general dentists in the realm of serving the public. And so I think that's what's important.
Okay. For both of you, do you have any strategies or ideas for improving the licensing process, whether it be for just general dentistry or for specialists?
And you said, can you repeat the question?
Improving the licensing process.
So I think that it has to become much more efficient. I think that one of the concerns that it takes quite a long time. I think that what we can do is try to bear standards with look at other communities. DC has different regulations compared to our surrounding areas. And I think we have to just really evaluate that as far as what is the best practices in the dental community, as far as regulations, but also as just in terms of expediting the actual processing of licensure.
Dr. Roberts?
I agree as well with Dr. Lewis that, expediting the process, but making sure that we're efficient. I think one of the other doctors from the Board of Medicine spoke earlier about using AI in that process. I'm not super familiar with how we could do that, but I do think that if there was a little bit more of a methodical way for us to be going through these license applications, or even opening up the application process a little bit earlier so we could start getting some of that information in there just from the doctors who are ready, that could be helpful. I do know that there is an issue right now coming before the Board of Dentistry when we talk about licensure requirements for specialists as well. And I know that's a very hot topic right now amongst my specialist friends. So I would really like to continue hearing from our specialist colleagues on their reasonings, to support or just not to support some of these cases coming up when we're talking about whether or not the specialist should actually have a separate license from the general dentist.
Yeah, I'm glad you brought that up. So we do have a bill that's before the committee. It's called the Dental Specialties Licensure and Scope of Practice Amendment Act of 2023, which establishes eligibility requirements for dentists who pursue a license in a specialized field of dentistry. I think we have a hearing July 10th. That's why we have staff. I knew we had a hearing. I couldn't tell you the date, but we have a hearing on this bill on July 10th. One of the requirements is that one must hold the diplomat status for of the desired specialty. I'm curious if you all have any initial thoughts about this legislation. Obviously, we will welcome hearing from you on July 10th about this bill.
I think that it's, again, when you are a specialist, you want to reach the highest level of your specialty. So that is what I've done as a board certified periodontist. However, I became a specialist when I completed my graduate education. So to me, in my opinion, if that should be what the standard is. Have you finished an accredited residency program to make yourself a specialist? I don't necessarily think that you have to go to it's nice if you did. I mean, I obviously thought it was important, so I completed that additional training. But I believe that I became a specialist when I completed my residency program.
That's great.
I agree with Dr. Lewis. Some of the worries that I've heard from some of my colleagues is that there's some specialties where it takes several years before they can become board certified. They'd have to have so many years worth of cases that they can bring before the board. And if that, if you finished your program and you're able to practice as a specialist, but then not be able to have a license in the place where you would be practicing because you haven't reached that board certification level, that would be a little bit of a concern. And I would hate to be in a position where we're taking away providers from our community.
Who are waiting to get that board certification, but how then do you get the cases that you need? And you can't practice, you don't have licensure. No, it totally makes sense. I'm very familiar with the board certification process on the education side with teachers. It is usually someone who has been practicing for 20 years as an educator before they go to be something to that effect, before they go to be nationally board certified. You have to have a large portfolio of showing your work, and have been able to be teachers that entire time. It hasn't stopped them from being able to be licensed. So we'll deal with that bill when we get to that bill, but thank you so much for being here. I'm going to turn to the Commission on Health Equity nominees. Okay, so this is a question for all of you. When we got the nominations, I had a big question mark for my staff because we know from DC Health that this commission has not met since 2021. I think there might be one person who is currently confirmed. That is all. So what is your understanding from DC Health in terms of restarting this commission and the work that they are going to be asking you all to do? Whoever wants to go first.
Every time that we start something is good, right? That was my first kind of reaction to it. I was not very familiar with the work of the commission, but when I understood the commission was reconvening or putting more people into it, and I thought the opportunity. I think we need to participate, and I think we need to make this a strong commission. So I felt compelling to say yes to this, to make sure we make a strong health equity commission.
Okay.
The challenge that we have, I think, is how I think health equity has to do with everybody, right? And then sometimes to put this in one area can be hard to bring the right people or the right intention to make that a component. Also, health equity touches too many issues that we need more accountability so we can have everybody really experience the city the same way. And this can be hard to, I think I can imagine that people can be tired, and then we need new people to come in to keep pushing the agenda.
Okay. Ms. Strahan or Dr. Niels Barker, did they tell you what the deliverable would be for this commission? So originally when the commission was established, it was established to inform the work of the Office of Health Equity at DC Health, and then they produced a report. Did they say there was going to be a report? What's the deliverable?
So I understand that the deliverable to be a report. I know that the last report was, like you said, a few years ago, I think as 2020. Well, there was like some type of update, 2021 or something like that. That might have been like an amendment, but, and I'm trying to get my bearings with that. But I do understand that there's a new report, and then I know that it's a new era almost, because that was coming right out of the pandemic. And a lot of the data was about COVID-19 at that point. So my understanding is that there needs to be an updated report reflecting, I think, at least the time span from that report to now.
Okay. Dr. Van Balen?
One day, maybe I'll be a doctor, but not yet.
Sorry.
Thank you. So I was aware that the commission has not been meeting, but my understanding was that Dr. Arno and Moda were working together to rebuild the committee and essentially carry out the function of the committee. But that is my current understanding of the work, and certainly in as I mentioned in my testimony, to work to make recommendations on health equity to the mayor.
Okay. So let me ask this. And I'm not let me just be clear, not opposed to the commission. Obviously, we're holding the hearing in terms of the commission moving forward. And I think health equity is certainly important. And I think all of you have qualifications to do this work. DC Health just has never been clear with us in terms of what the work is that you're going to do. And so I believe that if you're going to serve on a commission and give of your time, we should make sure that you have something to do in order to show value in it for yourself, but also in the future, when your terms have expired and we are bringing someone else on, we can demonstrate to them what they're going to be doing and what the ask is. So in 2018, they did the health equity report, which was this landmark report about drivers of disparate income health outcomes here in the district. In 2021, the report that they put out was a summary of the health equity summit that they had. So to your point, Ms. Stretchen, like there's certainly a need for a new report and a new outlook of the things that we are doing. So let me ask this, if confirmed for all of you, what do you believe should be the first 3 actions of the commission? And I don't actually think, though, there are enough of you for quorum yet, because I think there will only be 4 of you, but that's okay. We can work through it. But what do you believe should be the first actions of the commission?
So I'm pretty familiar with Dr. Arno's work in the past. And so I think revisiting the initial health equity report, getting a sense of where things are since that report, and from that doing an assessment or kind of a scan across the city of kind of the key issues that are emerging that are needing to be addressed. And so I certainly kind of building off the great work that Dr. Arno has already done, I think is a great starting point. And from that, our city has changed dramatically, particularly since COVID-19. And so there's some new emerging health issues that we might want to take into consideration and figure out the right recommendations to move forward based on that.
Thank you. Ms. Van Balen?
Yes, I think that similarly, like looking over that report and looking at some of the models, and there were key like identifying factors that were outlined. I think looking at where we are now, like doing an assessment of what those recommendations were at that time, and then looking at how we can retrieve data or do some type of, well, I guess it would be retrospective from, from now to that time, and look at where we would need to go forward. Because I think it would be smartest to build off of what has been done, but then also being able to find gaps maybe that are just new for this present time.
Yeah, I would agree. I think there's an opportunity here, right? Because we have post-COVID. There's so many different things that's going on. I think there is such a different environment, but at the same time, so much awareness of health disparities and how things impact our city. So I think there is an opportunity here to building on what was done before, create a new approach and how to explain health equity. I think we're still not understanding, all of us. Sometimes we say those words, right? Social determinants of health, disparities, health equity. But I don't think we're in the same page, right? I mean, social determinants of health is nothing that's social needs, right? A social determinant of health can be positive, right? Some wards in DC has good outcomes because of the social determinants. So there is so many language that we need also to kind of discuss and make this also understood. I think Dr. Arnold did a lot recently on health literacy too. I mean, the DC Health has putting a lot of energy on health literacy. I think health equity needs also some ways of translating it to everybody else, including the mayor, right? Because can be very complex and full of jargons, but also can be very grounded on policy that needs to be or reinforced, to move on, right? Become less bureaucratic, become more to the point. I think there's an opportunity. I'm coming into the commission with that energy, like to get together and let's see what we can do this post-pandemic and bring that component, this important component that if you don't discuss all kind of discrimination from gender, class, race, immigration, if you don't get all this in layers of discrimination and see how this make the fabric of discrimination, a fabric of social discrimination, you don't understand. And we need to understand that, right? We need to understand class in the city. We need to understand gender. We need to understand immigration for me many times is class. It's a working class for me, right? So I think there's an opportunity. I just, I don't feel really comfortable evaluating the commission so far because it was not really with that.
Well, you are absolutely right. This is an opportunity to shape and create something new. And I know that Dr. Arno is open to that. I just want to make sure that all the commissioners who are coming in are eyes wide open around this is an opportunity to create something new. And there isn't, unlike the Board of Dentistry, which has like very specific roles and responsibilities of things that they have to accomplish each meeting. For you all, it is an opportunity to sort of create something new. So I just have a couple of technical questions. So as I mentioned at the top, one of the requirements is that each voting member must have expertise in one of the 6 areas. For 2 of you, we don't exactly understand how you got nominated in a particular area, so we just want to better understand it. So Ms. Strachan, you have been nominated, and they say in the documents that were sent to us that you were the expert in ecology and the natural built environment. I did not glean that from your resume, nor in your conversation. So might that have been a typo?
Perhaps. Maybe it was early childhood.
No. So interestingly, Dr. Lynn Barker, they had you as the expert for early childhood and learning education. Is that accurate or?
Yeah, when I had the opportunity discussing that, I think my background was a lot of girls and adolescent health.
Okay.
And also the work that we do now, not only in partnership with these daycare centers and the fact that as a Clínica del Pueblo, we have to do intersectoral partnership. A huge part of this is how to understand and provide is more families than the child in itself, but how to understand the component of keep the child in school and understand language access and understanding the system was an expertise that I brought.
Okay.
The other thing that
we were going to move you to minority communities and population health outcomes.
That's okay.
That seemed a bit more aligned, but
Mhm.
wanted to ask.
Yeah, I felt so, I mean, I think my biggest motivation was bringing to the voice of my experience into the commission.
Okay.
And also make sure we understand also the voice of immigrants in different components. For example, when you think about early education, I discussed with Dr. Arsenault this idea that the care economy, a lot of the care economy, a lot of daycare centers are powered by immigrant community, and the necessity for us to have a diverse city, but also integrated, right? To start creating this not in silos and but identify how we live together and work together, and the benefits of bilingual education for every single person, not to the limited English speaking community, but to everyone.
Okay.
That was my first approach to this, but I'm happy to serve as you all think that's.
No. I mean, our understanding of the statute is that it doesn't require that there be representation from all 6 areas, but that each nominee has to fit into one of the 6. The ecology one, I was just like, I don't, maybe there's some, I mean, bioethics, sure. But like, I was like, the natural built environment doesn't seem to be anything that she's talked about. So we'll figure that part out. But on that, we just wanted to ask as well. One final question for all 3 of you. If you had to pick one thing as the most pressing challenge issue, health issue that you feel like the District of Columbia is facing right now, what would you say? Whoever wants to go first.
I'll start with, I think, infant and child development, and I would say like perinatal outcomes, like what happens after birth. So working in the neonatal intensive care unit, I think that it's not just that the baby survived, but it's also like, what are the supports that they need to thrive, and what does the family need? So and I just know this like empirically, because of the pandemic, there are lots of waves of other epidemics that are happening that are affecting the ways that children just can even start life. And so we do have programs the district has, like Strong Start in early stages, but there is ways that we could intervene possibly before that. So that would be my.
Thank you.
I would say access and understand of preventive care. I think we have still a lot of our communities not understanding what is preventive care is. I don't think they trust the system when they are not really sick. They understand it is. We have a lot of trouble to have people coming to us before they get sick. And this is about them understand what's making them sick and also get to the system that can help them to prevent that. The system that can help them to prevent has to be an intersectoral system, right? Because without housing, without food, without education, without feeling secure, it's impossible. So I think it sounds complex, but I think there's many solutions out there. So I think the biggest problem that we have now, we have a city with a lot of options that are not properly used and they get wasted. And we need to work on that, right? Because it's a rich nation. It is a rich city, but it's so fragmented for the public to understand that they all end up on the emergency room when they are very sick. So it's not good for us. It's not good for them.
Right. And even the idea that preventative care also includes dentistry as well, because
I mean,
left unchecked, that could lead to some other issues as well. Ms. Van Balen?
Yes, I'm particularly interested in looking at how we can incorporate trauma-informed practices into our workforce development system and its intersection with housing. I think so many programs often have certain requirements, and if someone is a survivor of violence of any kind, often they can not be successful on their journey towards employment and or in maintaining their employment, which obviously impacts so much of their life, including their housing and other areas of need in their life. And so I'm particularly interested in seeing how we can do that, looking at mobility pathways and how we're looking at it from a trauma-informed lens.
Great. Well, I want to thank all of you again for agreeing to serve the district as members of a mayoral board. For those of you who are watching at home, this is my PSA for a second time. Volunteering for a board or commission is an excellent way to give back to the district, as well as inform program and policy decisions or scopes of practice if it's for a particular professional board. And we have many of them in the health cluster if you're interested in serving. This does conclude today's roundtable. The Committee on Health will hold its next roundtable on June 13th on several nominees for the DC Food Policy Council. We will have a markup on these nominations at some point this month, and we'll let you guys know if we have any additional follow-up questions. The time is 11:35 and this hearing is adjourned. Thank you so much.